Hi everyone, and today we're going to show you how to set up local anaesthetic in preparation of nail surgery. You can see I'm wearing gloves already. I've already washed my hands and I've cleaned my tray down and I've opened a sterile pack and I've taken the drape out of the sterile pack and just popped it in. It's more so for the video. I normally do it straight to the tray that I've cleaned, but just with the video, the glare of the lights, we're just popping it in today. We're going to set up 3 syringes and 3 setups in total. And the thing with this patient, our patient's 80 kilograms in weight, so that means they're over the 70 kilograms. So the maximum safe dose for this patient is 200 milligrams, which is still the maximum at 70 or above. So what we're going to do is we're going to try and set up 3 syringe setups, 2 mil in each. So that's well below, so we can use 10 mil in total of what is a 2% lidocaine solution. So we're going to make sure we don't set up more than the maximum safe dose for this patient, so there's no danger of actual overdose. So the first off, we're going to check the equipment, make sure everything's intact. So it's always important to make sure that the drug we're checking, so this is lidocaine 2% plain, and I'm just reading it to make sure that the batch number, the lot number is there and clearly visible, and the expiry date, and it's in date. It's lidocaine, there's no adrenaline in it. And no adrenaline is really important when you're injecting into an appendage, such as a toe or finger, because the adrenaline causes vasoconstriction, which can, in some cases, not be reversed. It can cause long-term damage for the client. So we don't need that for the minor procedure we're doing, so we make sure there's no adrenaline in it. As with all equipment we're going to use, and such as ampules and injection equipment, we're going to check that everything's intact. So it's sealed, it's not damaged, it's as it should be. The liquid inside is behaving as a liquid. There's nothing floating in it. There's no foreign objects in it, and it's not been tampered with. And once I'm happy that they're there, we can then, already had this wipe clean, so we're good to go. We're going to just snap. So it's a simple twist action with the plastic. In one of the later videos, I'll show you how to snap an ampule with different devices, but for today, that's easy enough. Okay, and then what we're going to check is we'll check the syringes next. So all we're checking for is the lot number and the expiry date. We're checking that the packaging is indeed intact. So moving on to the syringes, the same with all of the equipment we're going to use from now on. It's all packaged, single-use packaging, and it's all been sterilised. So once the packaging is intact, I can guarantee sterility before I open it. So we have to check that the packaging is intact. There's nothing been punched through, and it's looking normal. We're checking the batch number is clearly visible on the lot number, and the expiry date, the product is in date. We're going to record all that information on the patient notes as per the local policy here. So this is, because it's a sterilised piece of kit, you should be able to find there's an opening at the top. We don't ever push it through the packaging. We're going to open it as intended. So it opens out like this, and we can remove that. And what we do is we pop that into my pocket, and we're going to keep it for recording later. So we can keep it in our hand. We don't need to put things down unnecessarily. So the next thing we're going to do is we're going to take, this is a blunt fill needle. And what this needle is, it's blunt, and there's a filter in it. So what we do is when we're drawing up the solution, anything that could possibly, so it's more designed for glass ampules in case there's any shards of glass in it. But as it's best practice, we're going to continue to show you this one. So again, we're checking that the packaging is intact. We find the lot number that's clearly visible and that the product is in date. We're making sure it is what we need it to be. We find the area at the top where we can pull it apart. So again, we're not popping it through the packaging, and we open. And we keep that for later. This is the L.A syringe, and what that means is as I introduce the needle into it, you should be able to twist it and it should lock it in place. So it's not a push-on one, so if you watch very carefully, that noise gives you a good indication that it's nice and tight. Okay, we'll proceed now with drawing up some of the solution. So at this stage we can unsheath this needle. So even though it's a blunt needle, which you can clearly see there's no edge on it, we need to make sure we follow best practice. We're not going to be handling this, we have to treat it like a sharp. Okay, so we're going to draw the lidocaine or the local anaesthetic into the syringe now using the blunt fill needle. And the idea is we're going to make sure we introduce the needle through the mouth of the ampule without touching the sides and into the liquid. And you pull back on the plunger ever so slightly, and nice and easy. And what you should be able to see there quite clearly is the liquid coming into the syringe. We'll keep the 9 now, because I only need 2 ml in each setup. You pop this back down. Now, even though it's a blunt needle, we'll treat it as a sharp. So we're going to remove this with a pair of forceps. Remember, it's a lure lock, so we just simply twist, and then we drop it into the sharp. We'll pop that there. So at this stage, we're going to open a 27 gauge needle, so we can hold this on our hand. It's probably the easiest way. And we're looking for the 27 gauge, because this is the needle we're going to inject with. So we're checking the packaging is intact, that it has a lot number and that's in date, which it is. But I'm happy that it is the product I need. And then we're going to open it as everything that's been sterilised and packaged. It should be pulled apart. And again, the difference with this particular product is it's got a double lumen, so it'll be a little bit more difficult to get on. You just need to take your time, position correctly, we're twisting. And that's one setup. So I'm going to go through and set up the other 2 for this particular patient, and we'll do that quite quickly, so I won't talk too much. Again, I'm checking everything's intact and we're doing it. Make sure you have the syringe angled so you can see the gradient. You need to make sure you're not overfilling and wasting the drug. So again, pull back on the plunger. You should see the liquid start to enter the syringe setup. The next 27 gauge, it's all come from the same box, but even that I can't be complacent. I need to check everything. Packaging is intact, it is what I need. The product's in date and the lot number is clearly visible for reference later. You'll notice I'm not driving the air out or doing anything that side of things, because this is the preparation time before the patient comes in. So they're sat in the chair, but we're not going to do this in front of the patient. So we've taken their weight and their blood pressure before they're presented, and we're just going to go through this process. The patient isn't present for this bit. So the last one. So same again, make sure the gradient is facing it, hold the liquid so it's not going to spill out too much, and then pull back on the plunger. So a nice and smooth action, we're not moving it too quickly. A lot of people find there's a lot of bubbles when they draw liquid into a syringe, and it usually because of the technique they're just going too quickly with the draw. So take your time and go through the process and always follow the same steps, and you shouldn't make any mistakes. So our last one, 27 gauge, 1/4 needle, packaging's intact, it is what I need, product is in date and the lot number's there for recording later. And we pull it apart, take our time with the double lumen, and there you go. So the patient's given consent to proceed, so we're going to get cracking. So we're just going to wipe the area down, and as we're doing this, it's worth noting in these dummy toes, it's quite interesting that we have the interphalangeal joint, which is there, and then there's the space, and then the lump at the back here, the next lump, is the MTPJ, so it's the metatarsophalangeal joint. So it's not exactly as a toe will look on the body, but it's good for demonstration purposes. So our injection sites are clearly here, and we've just wiped the toe, so I won't be touching it again. Okay, we're going to just open up, so we'll take one syringe at a time. So the setup's there. So we're using the Safety Plus system today. So all this is, it's a system where once we've unsheathed the needle, we can lock it afterwards with this pink setup, and I'll show you that in a second. So we're just going to make sure we pop this off safely. and dispose of that sheath. Under no circumstances will be resheathing the needle. We're going to check now for air bubbles, so I can see one there, so I'm just going to hold the plunger, flick with my thumb, and the air bubbles have moved to the top. At this stage now you'll see that the black plunger is ever so slightly past the 2 mils, so I'm just going to proceed and push a tiny bit of drug out, and this has two purposes. The first one is that we can control, we know how much is in the syringe before we start. The second one is we're making sure that the needle works. So the companies make millions of these things at a time, so we need to make sure that the needle actually works and the liquid is coming out. So I'm happy there, everything's ready to go. So at this stage now, I'm going to hold it, I'm left-handed, so I'm going to hold my toe, medial and lateral. Some techniques will show you to hold it dorsal and plantar, but you really need to make sure that your fingers are out of the path of the needle. So we advocate that you do medial and lateral. So medial and lateral with one hand, and all you do is you flex the toe ever so slightly, and what that does in a real human is it gives us a little bit of skin tension along the area that we're going to inject. So we're going to inject in the area behind the interphalangeal joint, but well before we get to the MTPJ. So we're somewhere in the middle of the toe there, where there's a bit of bone, but we have a flesh either side, a bit of a target area. So all we do is we flex the toe, we warn the patient, okay Mr. Bloggs, there's going to be a slight scratch, just try to relax. The needle's at 90 degrees, and we pop through the skin. Once it's through the skin, we can release the toe now. We're still holding on with our arm, we're still controlling the limb, but we don't need to have this hand in play. We're going to progress down, and what we're aiming for here is the dorsal digital nerve. So this is the lateral aspect. So this is the patient's left foot. So we're in the lateral side, and we're aiming for the dorsal digital nerve. And all we do is hold my right hand, and ever so slightly pull back on the plunger to aspirate. Once I'm happy that no blood has plumed up into the area, into the syringe, I'm happy to proceed. Sometimes I might hold the toe, hold the foot, but I'm going to inject ever so little more amount. So I'm going to put 0.5 in. And then proceed, I'm going to just move my head and move the foot so I can progress the needle down. And what you should see ever so slightly, see it's starting to bulge at the plantar aspect. The patient will find that slightly uncomfortable because they're scratching the back inside of the dermis, and there's a lot of the nerves there and they don't like that. It's quite an uncomfortable sensation. Once I get to that stage, I withdraw ever so slightly, and that gives us down at the plantar digital nerve on the lateral side. So again, I aspirate, and then I inject. And then hold it like a dart, hold the toe securely and pop out. First thing I do is I make the needle secure and safe, so I push up the safety system till it clicks. Next thing I do is I check. Okay, so we're halfway through. So we're using very little of the solution. Remember, we're targeting nerve areas and areas where the nerves are. We're not doing an infiltration, and we're trying to flood the area. Some practitioners tend to use a lot of drug just to get it done, but we're going to use just what we need. We can always do a little top up if we need. We have plenty of scope here, but we're going to be nice and precise with what we do today. So we've done the laterals. We're going to move on to the medial digital nerves now. So again, we're going to remove the unsheath the needle, find the syringe, so flick out any air bubbles, and then we're just going to make sure, so a tiny little pressure on the plunger to bring us up to 2 mil and to make sure the needle setup's working. So we're halfway through the procedure now, so the patient's well aware of what's going to happen. That still means we still get consent. So Mr. Bloggs, a little scratch just on the other side of your toe, you're doing really well. So a medial and lateral pinch on the toe. Flex the toe to give some skin tension, needle at 90 degrees, and we break through the skin nice and quickly and release the toe. We hold, aspirate, and make sure there's no blood pluming into the syringe. Once we're happy, we'll inject. So I'm just going to turn it so I can see how much I'm injecting. I'm going to hold the syringe like a dart again. I'll just hold the toe this time, and we're moving down again. I'm dropping my head so I can see. I'm just going to come so we can see the tissue starting to bulge again. The patient will give you a little shout because it's a little bit uncomfortable for them. Pull back ever so slightly so we're in the lower quadrant of the toe. I'm going to aspirate again ever so slightly, nothing, I'm happy there, we're not on a vessel, and I'm inject again. Okay. Withdraw completely, holding the toe securely. We make the setup safe, and then we'll check to see how much we've given. So again, I've given 0.8 again, so 1.6 mil in total. So we're just going to dispose of this now. And it's good practice maybe to, in a real toe, you'll find that there's a little bit of blood and a bit of discharge from the area. So we'll hold the toe and we'll just give it another wipe. So you've just seen me inject 0.8 on the lateral board of the toe and 0.8 on the medial board of the toe. So it's really important that we always remember that we always record drug dosages in weight, so milligrams. It's not the volume that we've injected. So with the volume we've injected is 1.6 mil. So what that means is when we work that out, that's 32 milligrams of drug that we've injected today. So well below the maximum safe dose of 200 milligrams. And what that gives us scope for is, and that's where the third syringe comes in. So as we let that go off now for a few minutes, and then we'll test, so we'll get the patient to close their eyes, and then we'll have a little explore around the area just to see the patient shouldn't be able to experience the sharp pain sensation, but should be able to experience the motor function and movement. So sometimes patients can mistake movement and pulling and dragging for sharp pain. So it's really important as a practitioner you're describing that for them so they understand that it's not, they should still be able to feel you moving and touching them. It's just not the pain they should feel and that sharp sensation. So it's really important people understand the difference between an anaesthetised tone and a numb tone, which are very different things.